Hello, welcome. My name is Chris Bien, and I will be hosting this webinar today. I'm a senior associate with Casey, and I'm the engagement manager in Baltimore. We have a lot to cover, and I want to make the best of your time. Today, we will review the impact of the 2008 recession and anticipated effects on today's crisis in child welfare and the communities around them. And Dennis Blazey will be talking about those things. Rodney Brittingham will explore the strategic response to inevitable budget cuts and building a bridge to the future. And then we'll talk with you briefly at the end about opportunities, challenges, solutions, and next steps for you all. And with that, I will turn it over to Rodney.
Thank you, Chris. I'd like to also welcome you and thank you for taking the time to watch this webinar. I want to start by saying how much I appreciate the work you do, never more so than now in these deeply challenging times. I know we're all wrestling with a roller coaster of emotions regarding the moment we're in. It's overwhelming and frustrating and inspiring all at the same time. We at Casey are committed to move beyond words and symbolism to action. I hope this webinar helps you plan for the future and anticipate and stage any budget reductions to your agency service array. There is power in money. Let's prioritize and hold harmless what's most important for kids and families. Today, I'm joined by Dennis Blazey. Dennis spent 30 years in Ohio working on budget issues and has used those skills to help jurisdictions all across the country align values and programming with funding plans. He knows child welfare finance forwards and backwards and has an amazing ability to find answers from the maze of complex regulations and funding streams that confuse most of us. In this presentation, Dennis will share how past budget crises, including the Great Recession of 2008, affected child welfare budgets. We'll discuss how leaders like yourselves are running toward, not away from, the challenging issues of the day, such as COVID-19 and race equity, which we at Casey applaud. And I'll share why we at Casey believe that this may be the moment we've needed to spur systems and communities toward bold change. Dennis, please start us off.
Sure. You have before you a chart, a matrix chart that was executed by McKinsey consulting firm. And it was done in April. And as the pandemic has played out, I have consistently come back to this chart and this matrix to sort of discipline my thinking about how things will develop both in the near, intermediate, and long terms for child welfare. As you're aware, the pandemic has both a public health consequence, and that in turn has a knockoff effect on economic activity, both at the national level, the state level, and the local level. What you see in this chart is essentially a way of correlating what you believe will be the public health response in your locale, correlated to what you see as the various fiscal stimuluses that have come out to the states and locales, in addition to any actions that your states take, and what those possible impacts would be in terms of economic recovery. There is no right pattern here. It really comes down to what you see transpiring on the ground in your jurisdiction, and how this will in turn give you a sense of how that will play out. I have found this an incredibly useful chart in terms of disciplining my thinking on this matter. In the next slide, you can understand here how recessionary times impact state budgets, because in turn, state budgets are going to impact child welfare budgets. In 2001, you can see that there was consistently a reduction in overall state budgets for 4 consecutive state fiscal years. In the Great Recession, that kicked off in fiscal 2009. That pattern continued and did not remedy itself until somewhere around fiscal 14. Currently, we don't know the full effects of the economic damage that the COVID-19 pandemic will be doing to the state's budgets. But we do have a series of projections that have been put out by various organizations. This happens to be a correlation of projections put out by the Congressional Budget Office, Goldman Sachs, and was published by the Center for Budget and Planning. As you can see, they're projecting considerably more economic damage than was considered to be the case in the Great Recession of 2013. What does this mean for child welfare? What we just discussed was what was there in state budget implications. Child welfare budgets are inevitably drawn by local tax revenues and state tax revenues. Well, if the past is prologue, we can take a look at what happened in 2008 to get a sense. So on slide 8, what you see utilizing data that's publicly available from Child Trends is the effect of the 2008 to 2018 Great Recession impacts on budgetary spending for child welfare. As you can see, from 2008 to 2010, there was very little impact directly. But then the impact began to manifest itself heavily in 2012, 2014, when it bottomed, and then it slowly regained purchasing power through 2018. This would suggest that you're looking at least a six-year adverse impact in child welfare budgets. In slide 9, what we can start to see is how this then in turn impacted the various funding streams. Child welfare, as you're aware, is principally financed through a blend of state and federal money, with the state actually contributing more than the federal government does. In some jurisdictions, county money also participates in the funding mix. What you see here is, again, utilizing data that's publicly available from Child Trends, that in fiscal 2008, about 61 cents on every dollar in child welfare was a state and local dollar. That materially eroded 2 years into the 08 recession down to less than 59 cents on the dollar, but recovered in fiscal 12, fiscal 14, and it started to plateau in fiscal 16 and 18. And what's also interesting to note here is that state money is comprising a ever increasing percentage of how child welfare is financed. That's because of a number of reasons, principally of which you have an erosion in 4E rates of eligibility. But nonetheless, what this also indicates is that state budgets and, in turn, local budgets in county-administered states are going to be extremely vulnerable to economic headwinds that the pandemic causes in terms of state and local revenue. Not so much the federal. The federal government has the authority to deficit spend. Counties and states do not. And as a result, child welfare budgets now going into the COVID recession are increasingly exposed to stress because of their greater reliance on state and local money for their financing costs than was the case at the beginning of the 2008 recession. So again, if the past is prolonged, here's what you can expect how states are going to manage their current budgetary situations. They're going to be looking at tax increases and revenue enhancements. They're going to drain reserves, rainy day funds. There will be cuts in services and budget, usually across the board. And of course, states will try to squeeze out staff economies through layoffs, furloughs, reduced hours, and hiring freezes. They will also engage in what I call cash management activities, such as late vendor pays. What we see here is that history says recessions will lead to severe budget cuts and negative impacts. Those will generally manifest themselves in across-the-board budget cuts. So what kind of mitigating strategies can state agencies engage in? Not so much, I mean, the reality is you're going to receive a cut. The question is, how do you mitigate the adverse impacts of those cuts? So, what you want to try to avoid are things that create systemic problems for you. Removals and lengths of stay will likely be adversely impacted by cuts in spending. Hotline calls may increase and placement costs may explode as a result. We've not seen that yet. Some people believe that as we emerge from our homes and children return to schools, this may become a expanding issue present in the caseload dynamics. Caseloads tend to grow, not so much because more children are coming into care, but often because staffing is reduced because of hiring freezes, which means that staff are in turn caring for more cases than they normally do. That in turn will have echo effects or knockoff effects in terms of expanding lengths of stay as permanency begins to freeze up and atrophy. Community nonprofits and providers will inevitably face budget cuts and rate cuts and service cuts and contract cuts, and that will in turn adversely impede the social safety net that will be available for child welfare to access. Finally, this should go without any saying, we will be experiencing considerable amounts of political turmoil as this progresses, if we've not already seen that to date. In slide 13, what we need to understand is understanding the post-recession impacts. As I indicated, you might see increased use of congregate care as your staffing capacity to recruit and develop new foster homes is diminished because of hiring freezes and or contract cuts. You will likely have an increased reliance on private providers for foster homes, again, because you're not going to be able to hire locally. Your community nonprofits and providers will struggle. There will be increased legislative interest in privatization. And I think you're also going to see deepening disproportionality. We've already seen that the public health effects of this pandemic are deeply impacting minority populations at a greater rate than they are impacting white populations. There will also be an increasing tendency of child welfare agencies to attempt to manage CPS intakes and investigations to fit capacity. That in turn will lead to an expanded use of unlicensed relative care with few supports. And as I noted earlier, fewer caseworkers will result in higher caseloads as measured in the number of cases each worker is carrying. outcome that in turn has a knockoff effect on outcomes for children. Child safety will inevitably be diminished. There will be an erosion in permanency, which will in turn echo in expanded lengths of stay. That in turn will ultimately echo, though it's not mentioned here, ultimately echo in a structural budget deficit as you continue to pay for per diems for placements that you could have moved out of the system through a permanency outcome. And for teens, there'll be a higher rate of unnecessary entry and aging out. So, what are some optimal strategies? Well, first of all, focus on improving child and family outcomes. With your remaining dollars, you really want to achieve value for the dollars spent. Also, try to avoid across-the-board budget cuts by strategically reducing costs and advancing prevention. Though it's not mentioned here, there are some other things that I would recommend as well. I would try to preserve at all costs permanency practice. You need to be able to timely discharge children and youth from care into permanency outcomes on an ongoing basis. The reason is that if you don't, you will have an expanding length of stay. And that, in turn, will echo in terms of increased placement costs as per diem census numbers expand. That, in turn, will create a structural deficit that will have a reinforcing effect on continuing to put stress on your budget. And really focus on preserving permanency outcomes. So I'm going to turn it over to Rodney now.
Well, Dennis has certainly laid out the stark challenges we'll likely face and some concrete ideas about a path forward. Thank you, Dennis. When Dennis initially shared his thinking with me on this topic, something he said really struck me. That after working closely with many agencies across the country during this time, he experienced firsthand how committed leaders, such as yourselves, are running toward the problem and not away from it. The children and families you serve are going to need that energy and commitment moving forward, and we at Casey appreciate that you stand ready to make a difference at this critical time in our field. Before we talk in more detail about fiscal strategies in this particular context, I'd like to offer a framework or a vision for your thinking. I suggest that we measure our actions through the equitable well-being of children and families and the good outcomes we hold for them. Let's be bold enough to try innovative approaches to support families well before a call to the Child Protective Services Agency becomes inevitable. Let's be brave enough to stop doing things that simply are not working. And let's be compassionate enough to strive for solutions that give all children the opportunities we would want for our own. Next slide, please. Holding that framework in mind as you consider key strategies for managing now, right now, and in the months to come as you enter budget deliberations, we want to offer these strategies. The first two are technical. You'll have to accept that budget cuts are inevitable, and you'll need to look for technical and workforce innovations to absorb some of those cuts. That means taking a hard look at current programs, how you're spending, and how you can spend less and reach for efficiency. The second two are equally important and perhaps even harder than the first two. They are critical to doing well by the children and families we serve. You must provide a clear new vision. Everyone in your community and on your staff, every provider you work with, everyone needs to know that you're putting kids and families first and refusing to continue old ways of working. You can do this by providing actionable choices that put family and community first, by promoting better approaches for teens and their families, especially teens and families of color, actively implementing the Family First Prevention Services Act and the key provisions around congregate placement, as congregate placements are dangerous and the most costly service in our continuum. And most importantly, Build trust with the community and the appropriators in your legislature. Demonstrate to them that you have a handle on your finances and need their support to make sure cuts don't impact what families and children need. Lastly, use this moment in time to partner in new ways. Engage youth, families, and community to design programmatic solutions. Involve families, cultural organizations, grassroots, and faith groups in communities. And support providers in finding financially feasible ways to work differently. Next slide, please. As I said earlier, we at Casey think this is an opportunity moment to spur systems and communities toward bold change. So how do we take the first steps toward this vision? Here are 4 themes to keep in mind as you think about how you're going to manage your agency's finances and work differently. Let's prioritize supporting birth families, kin caregivers, and co-parenting in foster care. Did you see the new materials from the Lancet Commission on the Institutionalization of Children? It makes it unequivocally clear that children need to be in families, not in congregate care, and whenever possible, with their own families in their own communities. Dramatically reducing or eliminating congregate settings saves lots of money. Spend your dollars on supporting families instead. Also, don't try to do it all. Work with others to figure out what you don't need to do, especially those with lived expertise. You don't need to criminalize poverty, for instance. You won't need to accept a CPS investigation for kids who are missing school just because they don't have a laptop at home. And then who will be your providers in strengthening the economic and social position of kids and families in your community? While you're working with new partners, bring kids and families into your agency, ask them what do they need, what can you stop doing, and then use your data to help tell the story. Next slide. To say this in a slightly different way, now is the time to find savings, focus on equity, prioritize families, and work differently. If I could underscore 2 important points related to your spending to child and wealth and youth well-being and equity, most often, teens don't need to be placed in foster care. Work with providers to make available supports for families experiencing conflict. Provide a front-end family respite program. Provide navigators to find necessary supports. Give kin more money to support their own family when they need help. Support efforts to build young leaders and meaningful community roles for teens. And then look at the effect of congregate care on your overall budget. Look for other ways to build safety, well-being, and permanency for these kids that doesn't involve unnecessary entry into the system when possible, and focus on having them in families and not institutions if they must enter briefly. So it's been an honor for me to share this information with you today, and thank you for viewing this webinar. Now I'll hand it back over to Chris to wrap us up.
Before we go, I wanted to mention a few next steps that you might want to take that are on the slide here. Today's presentation obviously is only an overview of a very complicated subject. If you have questions or are interested in further assistance, please contact Rodney at the email address on the slide above. Also, feel free to share this presentation with colleagues if you would like. And you will also see on the slide, there are additional resources, some from Annie E. Casey Foundation around COVID and around foster parenting. And also there is a call for leaders, providers, and communities that Casey Family Programs and Annie E. Casey Foundation is organizing around coping with COVID-19. We especially want to call your attention to the resource from the Center on Budget and Policy Priorities that Dennis remarked upon earlier, because it's particularly good in giving more detailed financial projections for each state. So on behalf of Dennis, Rodney, and myself, I'd like to thank you for your participation today and for everything you do to juggle the complicated work of child welfare day and every day. Thank you very much.